Okay, welcome back, everybody, for our final sessions of what has been an extremely rewarding conference. We are going to hear from a handful of companies who are leveraging technology to develop devices that can not only monitor our health, but also detect threats to it. In particular, we'll be talking about health sensors in the developing world. We have an extremely unusual first demonstration of a mobile ultrasound. I would like to invite you to turn your attention to Angela Baker, Director of Qualcomm Wireless Reach, Åsa Nordgren, CEO and co-founder of Trice Imaging, and our very own, my colleague, Fortune senior writer Lena Rao, whose role in this demo will be apparent to you in a moment. And I'd like to point out to you that Lena's husband and brother-in-law are in the audience for this demo.
Hi, everyone. My name's Angela. I work for Qualcomm Wireless Reach. Every day around the world, 800 women die from preventative causes that are related to pregnancy and childbirth. And 90% of those women live in the developing world. At Qualcomm Wireless Reach and Trice Imaging, we work together on a program in Morocco called the Mobile Ultrasound Patrol Program.
So picture this taking place in a tiny little hut in rural Morocco, in the Atlas Mountains, 4,000 feet above sea level. This is Fatima, and a nurse has traveled to see her, and she's 15 weeks pregnant. Where Fatima lives, it's freezing cold. It's 4 hours to the closest healthcare facility, and there's no doctors on staff. Fatima's family doesn't own a car. They walk by foot or use their donkey. So the nurse that visited Fatima brought a portable ultrasound device with an embedded encryption software to it. The scanner is connected to a global health cloud for sharing and collaboration via the 3G network. That means that she can scan pretty much anywhere. The nurse sends the study to a maternal-fetal medicine specialist in Paris, Casablanca, or pretty much anywhere in the world. The doctor get a ping or an alert to her cell phone, and she can go to a screen, a computer, a laptop, or a phone, and open up the patient case. In that viewer, she can do measurements, she can pin things, she can make comments, and the nurse, back at the hut, instantaneously see what's going on. So she can tell Fatima that her baby is doing just fine and the pregnancy is absolutely normal. The patient also get access to the studies from their cell phone. They get an encrypted link to a landing zone out on the internet where they can see the stills, the images, and the reports, and bring them with them to the next visit, or go for a second opinion, or just share it with family and friends.
Can we switch it back to the computer so we can see the ultrasound image? Perfect, thank you. So we believe that giving birth should not be a matter of life or death. And that's why in 2013, we worked together in Morocco on a program that looked very similar to this. Over 3 weeks, we scanned 575 women, and we collected over 3,000 images. And we had some amazing results. And if we could pull those results up, that would be great. We were able to get the cost of a medical diagnosis down from $80 to $2. And we reduced the time to get a medical diagnosis, that second opinion that Åsa was talking about, from 2 weeks to 24 hours. Because we were no longer printing out and mailing ultrasound images or x-rays, we were sending them over the mobile network. 92% of the medical practitioners learned skills to deliver ultrasounds, up from 20% before our intervention. And one of the biggest and most surprising things we saw was that there was an increase in the number of deliveries that were happening at clinics. So rather than at-home births that could be problematic if some sort of unknown symptoms or problems arise. And due to the success of this program, the Moroccan government has actually committed to scaling it. So Qualcomm is no longer funding in-country. The government is scaling it to an additional 10 health clinics this year, with plans to scale to additional health clinics in the coming years. So we started thinking, what does this mean globally? Globally, almost 300,000 women die every year from preventative causes related to pregnancy and childbirth. And we at Qualcomm know that mobile can provide that much-needed access, or that point of care. And so we know that this type of wireless tech can have far greater reaching goals across the globe for maternal and child health.
But the technology goes way beyond maternal health. Imaging is a very important tool for diagnostic and treatment. And such global health issues such as Zika virus, cancer, HIV, various types of traumas, imaging technology can really make a difference, both in diagnosing and treating the patient. The TRICE technology is deployed in the United States, in Europe, in Middle East, Northern Africa, Australia, and New Zealand. But the lion's share of our users is actually right here. We have the same types of concerns here. We have issues with sharing with patients. Data lives in silos. We have interoperability matters. And the technology like this can provide access to the images within health records, open up archive to archive, et cetera, et cetera. So mobile ultrasound can actually provide high-quality care regardless of who you are and where you are.
Thank you.
And thank you, guys, for helping us with the demo.
Now, wait, before you go, quick question before you go.
Oh, sorry.
So, other than the fact that the technology is mobile and that you're beaming it wirelessly, I assume in a developed world situation, the doctor and the patient would just view the information while it's happening, right? That's what I remember from when my wife was pregnant. Mm-hmm. What's the difference here? What is new?
Well, the fact that you get your health record with you directly to your cell phone instead of a printout or a CD. Or if I am a general practitioner and need your advice, Mr. Cardiologist, then I can send it to you instead of calling FedEx or using a fax. We heard yesterday about how many faxes Athena Health is carrying every day. We solve for that problem as well.
And so I'll say it this way, because so we go to these huts in Morocco. There's no technology, there's no electricity. There's battery. There might be a battery that's getting a little bit of electricity into the house. The doctor is coming in with this very high tech ultrasound machine, or it's an ultrasound tech who doesn't actually know how to read the images, but they can take the technology, send it over the 3G network to a doctor in Casablanca, in the US, wherever, and get an opinion much quicker than if you had to print it out. So that's sort of the difference here, because these women that we were meeting with in region, they might have 2 or 3 kids, but they've never had an ultrasound before. And they shared stories of how there were women around them that had died from, causes that could have been treated if they had been able to see, what was going on.
Thank you so much. And although she's off the stage now, please a warm round of applause for Lena Rao for sharing her pregnancy with us. Thank you. Now, please welcome founder and CEO of SOA, Kevin Hart.
Hi, guys. Perfect. So ZOA is a global air quality analytics company started in 2013. And when we think about airborne pollution, we think about haze and smog in China. We think about respiratory conditions like asthma and COPD. But since ZOA started, what we've discovered is that air quality impacts everybody, and in ways that we never thought were possible. So air quality affects white matter in the brain. It affects prenatal health, and it affects our fundamental productivity on a daily basis. And that last point is really important because it builds the economic case for why clean air matters. And the government has given us the constitutional right to clean air, but most of us don't know what we're breathing. And the government has set up sensors that cost tens of thousands of dollars around major urban areas. And that gives us a picture on a macro level of what the health of our city is, but it does not give us a micro picture of what the health of humans are, the health of us. And it makes sense that the governmental sensors are very far away from where we are, from where sources of pollution are. Because if somebody's smoking a cigarette or driving their Volkswagen diesel vehicle past a sensor, you're going to have a public panic because the sensors are reporting a bad air quality score for the city. So we've gotten permission from the government to ingest their air quality data that exists into our analytics platform here. And the first thing you'll notice is that there's gaping emissions in the data itself in certain areas, as well as our fundamental understanding of how this pollution works, what's actually happening here. Furthermore, if we zoom in, you'll see that there's 2 or 3 sensors per major urban area. And the sensors are coming in and out. And that's because the sensors are complicated. They're hard to maintain. And this is up in Vancouver, Canada. So what we built, ZOA has been refining a sensor technology that for the last 3 years has proven accuracy of 96% at a 400% reduction in cost to governmental sensors. And last year in 2015, we won the Time Magazine and Popular Science Invention Award after we had proven this out. So what we see on our devices is that they send data directly both to this cloud database, but also to something like an iPhone app. And so this app is telling us that the air in here is clean. But just a little demo. The particles, if you can see this, are showing 30 right now on this graph. And just using some invisible particles, we're able to see the count go up to 40, and it goes up to 60. And you can't see the particles. They're very small, they're fine, they're invisible. And it's up to 80, and it'll keep going up. So these sensors are incredibly sensitive to pollution. And the cool thing is that this data feeds straight into this analytics database. And so here, in this example, we have a sensor set up thousands of miles away in Calgary, Canada. And if we click through here in the details, we can see a live feed of this product in real time. There we go. And so not only are we getting the concentration of pollution, but we're getting a greater depth of information. So we actually know what types of pollution. We have different types of sensors. So we're detecting the particles in the air. We're detecting the chemicals. And it goes deeper. It goes into what is the size of the particles? What are these particles?
Kevin, excuse me. Sorry that we're out of time, and but as we wrap, I just want to ask you a quick question, which is how do you expect people will react to and use this data? How is that different from the government sensors that already exist? Exactly. So one of the last points we have here, if you're asthmatic and so we have a wearable device. If you're wearing the wearable device and you have an exacerbation, and that happens multiple times, what we can tell with this depth of data is the types of pollution and the quantity of pollution that creates that event for you. And on the 4th time that you have potentially an exacerbation, we can tell you before it happens. We can give you advance warning that conditions are ripe for this condition. And so we can prevent emergency visits by notifying that person in advance and providing them with the appropriate recommendations, the solutions that they can take to prevent it. And so in other words, they might want to stay away from an area that has too much pollution for them. They may want to stay away, but also it could be as simple as wearing a dust mask. There's inhalants that are just coming out in Germany where it actually protects your lungs with a sort of mucus. So there's all sorts of new innovative solutions for pollution that are coming out, and the customers need the ability to understand the situation and which solution to implement based on that situation. Very last question, how are you going to sell this? Who's the customer and how do you sell? So we're launching hundreds of thousands of units next year in China and India. That's one of our main focus. We're also launching devices here in America, mostly for the indoor built environment where pollution can be 2 to 5 times worse, outdoor pollution. For individuals at retail? Yep, going through either partnerships or direct to consumer. Kevin Hart, thank you very much. Thank you. And now our final demo is from the co-founder of Kushi Baby, Ruchit Nagar.
I have a few gadgets, so let's get this started. My name is Ruchit Nagar, and I'm here to tell you about Khushi Baby. Khushi Baby means happy baby in Hindi, and it's our goal to have happy and healthy babies around the world. Unfortunately, 1.5 million children under the age of 5 die every year from vaccine-preventable disease. Now, we have vaccines, but the bigger question is who is not getting them? And that's much harder to answer. So consider the case of rural India, where a mother walks with child in hand for half an hour in order to get to a makeshift campsite. This camp occurs once a month. She presents her health card, which she has to hold on to for 2 years, to the health worker. Now, this card is often lost, forgotten, or not filled out. And what happens? The health worker has to reference a logbook, but ultimately ends up asking, was your child born before or after the harvest, in order to determine which vaccine to give to the child today. We think that we can do better, and we've built a technology platform that allows us to redefine the health record from the ground up. So what are the components of this technology platform? We give health workers an Android application, and we give patients the ability to wear their medical history for the first time in the form of this necklace. Now, this necklace has a near-field communication chip that stores 1 kilobyte of data. This is off-the-shelf technology that allows us to store the child's vaccine history, for example. It's durable, waterproof, does not use a battery, and most importantly, this black thread has a culturally symbolic meaning that's relevant for sparking engagement towards things like immunization in these communities. So now, let's switch over to a demo and see what would happen if a child were to come to a camp that's using the Khushi Baby system. So here I have the Khushi Baby app on my phone, my Android device. Can you all see it? What we're going to do with a new patient is we're going to start off by entering in some basic identifying information. So that's me, Ruchit. This doesn't take too long, but this is the only time that we have to actually enter information. Now, we collect the phone number so we can give these families automated voice call reminders in their own dialect. This is my phone number in case anyone wants to get in touch with me after the demo. Okay, so we've generated a unique ID for the patient, and now it's time for us to initialize their health record. There you go. So what we see here is for this child, the vaccines that they need, when they're due, and when they've been given. With a simple tap, we can see which vaccines are due today. In this case, OPV1, DTP1. But oh wait, we can't give hepatitis because we're out of stock. Well, with our app, we can actually record that, and it's important for us to know what the true demand is. The only way we can know that is by also recording failed encounters. So now that we've entered the data and given the vaccines, it's time for the magic moment, to save the data and update the patient's record. There you go. So now, let's say the child goes to a different vaccination camp in a different village the next month. And there's a different health worker, and the health worker is using a different tablet. And the tablet isn't synchronized. Well, we don't have to start from scratch. We know that this is an existing patient, and what we can do is we can just scan it, and bring up the health record. Oh, that's not what I wanted to do. And here you can see that last month, if we can zoom in here, the baby did not get that hepatitis shot. So this all happened without connectivity, no strings attached. The big picture takeaway is that we've decentralized the health record. It allows the patient to have a digital interface to the health provider anywhere in the world. And this is more than just frugal innovation for rural India. What it really represents is a new paradigm for thinking about how we address the interoperability challenges between health providers. We can store a lot more than just vaccines on this record in 1 kilobyte. This is about letting patients own and literally wear their medical history. With the support of groups like UNICEF and Gavi, we are poised to scale this up across multiple countries in the coming year. And Khushi Baby can only grow with your support, your ideas, and your participation. All it takes is something as simple as wearing a necklace. And I'd like to leave you all with one question. Where are your medical records? Thank you.
And one quick question for you. You mentioned the organizations you're working with and that you need help. it seems that you have to get, for example, an entire local government to buy in or it doesn't work, correct?
Right, so our target customer is the Ministry of Health. With the support of Gavi, we actually have the ability to go to the negotiating table with central ministries of health and get this out to the larger public. Because in the case of India, for example, where over 70% of health is delivered by the government system, that's the only way we can really scale.
Now, please, a round of applause for Ruchit and for all of our other presenters. Thank you.